Welcome to the Vitamins and Nutrients YouTube channel. Today we are discussing electrolytes. Electrolytes are substances that, when dissolved in water, dissociate into ions and conduct electricity. They are important for various bodily functions, including maintaining fluid balance, transmitting nerve impulses, and regulating the acid-base balance. Common electrolytes include sodium, potassium, calcium, magnesium, chloride, and bicarbonate. These ions can be found in various foods, such as fruits, vegetables, dairy products, and meats, as well as in electrolyte replacement drinks. Imbalances in electrolyte levels can lead to a variety of health problems, such as dehydration, muscle cramps, and heart arrhythmias. Electrolytes play a crucial role in many physiological processes, including electrolytes help regulate the balance of fluids inside and outside of cells, which is important for proper hydration and blood pressure regulation. Sodium and potassium ions are involved in transmitting nerve impulses and maintaining normal muscle function. Bicarbonate ions help regulate the acid-base balance in the body, which is important for maintaining pH levels. Sodium, potassium, and calcium ions are all involved in muscle contraction, and imbalances can lead to muscle cramps and weakness. Electrolytes, particularly sodium and potassium, are important for maintaining normal heart rhythm and function. Electrolyte imbalances can occur for various reasons, including excessive sweating, vomiting, diarrhea, and certain medications. Symptoms of electrolyte imbalances can include fatigue, muscle cramps, weakness, dizziness, and heart palpitations. In severe cases, electrolyte imbalances can lead to serious health problems, such as dehydration, kidney failure, and heart arrhythmias. It's important to consume a balanced diet that provides adequate levels of electrolytes, as well as to drink enough fluids, especially during periods of physical activity or hot weather. If you're experiencing symptoms of electrolyte imbalances, it's important to consult with a healthcare provider to determine the cause and appropriate treatment. There are several individual electrolytes in the human body, including sodium, potassium, calcium, magnesium, chloride, bicarbonate, phosphate, sulfate. There are other electrolytes in the human body, although these are the most commonly recognized and studied. These electrolytes play different roles in maintaining various physiological processes in the body, including fluid balance, nerve transmission, muscle contraction, and acid-base balance, among others. The body needs a delicate balance of these electrolytes to function properly, and imbalances can lead to a variety of health problems. Other electrolytes include iodide, bromide, nitrate, acetate, citrate. These electrolytes are present in the body in much smaller amounts than the major electrolytes and play less well-defined roles in various physiological processes. However, they can still be important in maintaining overall health and well-being. It's important to consume a balanced diet that provides adequate levels of all essential electrolytes to ensure proper bodily function. If you have any concerns about your electrolyte levels or overall health, it's best to consult with a healthcare provider. Electrolytes from food and supplements can both provide the ions that are essential for proper bodily function, but there are some differences between the two. Nutritional value. Electrolytes obtained from food sources also provide other essential nutrients, such as vitamins, minerals, and fiber, that can contribute to overall health. Supplements, on the other hand, may contain only the specific electrolytes and lack the additional benefits of whole foods. Absorption. Electrolytes from food are absorbed along with other nutrients in the digestive process, while the absorption of electrolyte supplements may be more rapid and direct. This can be beneficial in cases of rapid fluid and electrolyte loss, such as during intense exercise or illness. Safety. Electrolyte supplements are generally considered safe when used as directed, but excessive consumption of certain electrolytes can lead to imbalances and adverse effects. For example, consuming high levels of supplemental sodium can increase the risk of high blood pressure and other health problems. Cost. Electrolyte supplements can be more expensive than getting electrolytes from food sources. However, in some cases, such as during travel or during periods of intense physical activity, supplements may be more convenient and accessible than whole foods. In general, it's best to aim for a balanced diet that provides adequate levels of electrolytes from a variety of whole food sources, along with adequate fluid intake. If you have any concerns about your electrolyte levels, or if you're engaging in intense physical activity or have a medical condition that affects fluid and electrolyte balance, it's best to consult with a healthcare provider for personalized recommendations. Here are some good food sources for each of the major electrolytes. Table salt, sodium chloride, soy sauce, deli meats, canned soups, and processed foods are high in sodium. Bananas, oranges, potatoes, spinach, and tomatoes are good sources of potassium. Milk, cheese, yogurt, and leafy greens, such as kale and broccoli, are rich in calcium. Whole grains, nuts, such as almonds and cashews, seeds, such as pumpkin and sunflower seeds, and dark leafy greens, such as spinach and Swiss chard, are good sources of magnesium. Table salt, sodium chloride, seaweed, olives, and processed foods are high in chloride. Bicarbonate is produced by the pancreas and kidneys and is not typically obtained from food sources. It's important to consume a balanced diet that includes a variety of whole foods to ensure adequate intake of all essential electrolytes and other nutrients. The symptoms of electrolyte imbalances can vary depending on which electrolyte is deficient and the severity of the deficiency. However, some common symptoms of electrolyte deficiencies include sodium deficiency, hyponatremia, fatigue, muscle cramps, weakness, headache, nausea, and confusion. In severe cases, hyponatremia can lead to seizures, coma, and death. Potassium deficiency, hyperkalemia, muscle weakness, muscle cramps, fatigue, heart palpitations, and constipation. In severe cases, hyperkalemia can lead to heart arrhythmias and muscle paralysis. Calcium deficiency, hypercalcemia, muscle cramps, numbness and tingling in the extremities, and seizures. In severe cases, hypercalcemia can lead to heart arrhythmias and difficulty with blood clotting. Magnesium deficiency, hypomagnesemia, muscle weakness, muscle cramps, fatigue, and heart palpitations. Chloride deficiency, hypochloremia, fatigue, muscle weakness, and confusion. In severe cases, hypochloremia can lead to dehydration and metabolic acidosis. If you suspect that you have an electrolyte deficiency, it's important to consult with a healthcare provider for a proper diagnosis and treatment. Blood tests can measure electrolyte levels and help determine the cause of an electrolyte imbalance. In most cases, electrolyte deficiencies can be corrected through dietary changes, fluid intake, and electrolyte supplementation, if necessary. Electrolyte toxicity, also known as hyperkalemia or hyponatremia, occurs when the levels of an electrolyte in the body are too high. The symptoms of electrolyte toxicity can vary depending on which electrolyte is elevated and the severity of the elevation. Sodium toxicity, hyponatremia, thirst, headache, nausea, confusion, muscle weakness, and seizures. In severe cases, hyponatremia can lead to coma and death. Potassium toxicity, hyperkalemia, muscle weakness, heart palpitations, nausea, and abdominal pain. In severe cases, hyperkalemia can lead to heart arrhythmias and cardiac arrest. Calcium toxicity, hypercalcemia, muscle weakness, confusion, and abnormal heart rhythm. In severe cases, hypercalcemia can lead to kidney damage and coma. Magnesium toxicity, hypomagnesemia, muscle weakness, decreased reflexes, and heart block. In severe cases, hypomagnesemia can lead to respiratory failure and cardiac arrest. Chloride toxicity, hyperchloremia, dehydration, confusion, and metabolic acidosis. In severe cases, hyperchloremia can lead to kidney failure and coma. It's important to note that electrolyte toxicity is relatively rare and usually occurs as a result of underlying medical conditions, such as kidney disease, or the use of certain medications. If you suspect that you have electrolyte toxicity, it's important to seek medical attention immediately, as it can be life-threatening. Thanks for watching. Don't forget to like and subscribe for more informative videos like this one.